We are very excited about this opportunity that the City of Fitchburg is about to embark on, and that is the partnership that we have with UW Health, Children's Hospital, and Safe Kids. We talked today a little bit already about the diversity of the City of Fitchburg, and we've talked about how we take care of our seniors. Safe Kids allows us to do the opposite on the age spectrum, but the same for our diverse communities. We know that we are one of, if not the most diverse community in Dane County, and this outreach allows us to get out into more homes and make a bigger impact on the lives that exist here in the City of Fitchburg. One of the things that you are probably well aware of is the fact that we built a brand new fire station. The firehouse on Lacey is going to remain our headquarters station. So there was some vacancy, and in talking about this, actually for the past 2.5 years, we have been able to identify how Safe Kids can do their work, their mission, by taking advantage of some of the space that we have available. I'm going to let Ben and Rochelle introduce themselves and their program, and then if you have any questions for us at the end, we're all here for that as well.
Thank you. So I will start and then I'll turn it over to Rochelle. My name is Ben Ethan and I'm the Director of Pediatric Trauma, Injury Prevention, and Child Protection at American Family and Children's Hospital. And one of my roles is, unfortunately, injury is the #1 cause of death and hospitalization for children, in fact, up until early adulthood. So from 1 to 44, the leading cause of death, and not by a small margin, is injury. And so as a level 1 trauma center, American Family and Children's Hospital has a responsibility to the community to look at ways that we can mitigate some of those risks. And a lot of that is through injury prevention, because the best treatment is not to have to treat that injury in the first place. And so American Family Children's Hospital has a pretty robust injury prevention program, and that is a requirement of the trauma center, and we will have that as long as we have that shingle, which we are very proud of. And so what we're looking at doing is looking at how we can get back into the community, because a lot of our children, unfortunately, have a tough time getting down to the main campus. And so we're looking for how we can bring those injury prevention programs out to the community where it's easier for families to get to, it's easier to get to the children, and it's easier to partner with our communities because, especially in trauma, this is not a building that is a trauma center. It is the entire community. It's everybody from EMS all the way through rehabilitation after the injury if we are unable to prevent it. So on a selfish standpoint, I have 3 children and 4 nieces and 5 nephews, all within Fitchburg, and so we have skin in the game as far as trying to prevent some of these injuries. Some of the things that we're very happy to talk about are some of our injury prevention programs, and I'll let Rochelle kind of get into what we've done in the past, and then I can talk a little bit about kind of our future plans for that space.
Perfect. Hi, I'm Rochelle Ethan, and I am the Injury Prevention Program Manager at American Family Children's Hospital. And I kind of just want to talk a little bit about what we're about so that you kind of know what we do. We are an organization through Safe Kids in the Children's Hospital that we bring businesses, we bring other healthcare agencies, police and fire departments together to offer evidence-based programming that helps prevent injuries for children. We have been doing this for a very long time, long before me. The partnership with Fitchburg actually started over 15 years ago, so long before any of us were part of this. It's phenomenal to see where we've come and the things that we're able to offer the city. Fitchburg has, for the past 15 years and over, let us use space for car seat checks. So once a month, we are at the Fitchburg Fire Station, and families are coming in. We're offering them car seat checks, providing them free car seats, and really helping keep children safe. So we're super excited for all the things that this building and this space is going to allow us to create in the future and how we can help prevent injuries.
So kind of the programs that we're thinking about basing there. So American Family Children's Hospital is the organization that oversees the Safe Kids as well as some other initiatives. And Safe Kids is a national organization that has state chapters, and then we are a regional chapter within that organization. And there's some funding associated with that, and there's some initiatives that they have, things like safe sleep environments, car seats, playground safety, some of those type of initiatives. And then beyond that, things that American Family Children's Hospital also would like to look at. So things like firearm injuries, suicide prevention, playground safety, it kind of runs the gamut. Wisconsin has a wide range of injuries that we see, everything from coming from Philadelphia, before this, we didn't have nearly as many large animal injuries, so we have all the, the farming, agricultural, all the way to the big city problems that we have here as well. And so looking at what we can do to mitigate some of those things. The people that we based out there are Rochelle, who is the program manager for injury prevention, so kind of has the overarching ability to make decisions on the program's behalf. We'll have a bilingual car seat specialist who speaks Spanish and does a lot of programming out here. And as of today, we hired a Hmong-speaking car seat specialist as well, so we can offer services in a couple of different languages, as well as we have some interpretive services. We're also very happy to do some children induction into the safety from an early age, and so we do some programming where we bring kids as young as kindergarten in to talk about how to cross the street, how to, stranger danger, how to prevent fires, the wide gamut that we have. It's a very loud 2 weeks of time and some very great partners that we have. Fitchburg Fire was able to do that this year. We have some community groups that have asked kind of to partner with us, and one of the benefits is we have some resources we can offer, and so we're having, I think, about 100, 120 high school age students who have an interest in either law enforcement, EMS, fire, or healthcare, and want disaster preparedness training, are going to come through and do some training at Fitchburg Fire. That's part of this kind of initiative. And I think the best part is we don't have any preconceived notions of what it has to be, because one of the things that we want to do is what the community wants. We see it as our mission to bring the programming that the community wants into the program. So we have the experts that we can either use our own or tap into. And so we want to know what Fitchburg would like us to offer there in addition to the curriculum we already have.
Great.
So with that, if there's any questions, we're happy to answer.
Questions at all that anyone has about the program and the partnership?
There's one closing.
Julia, yeah. Julia.
Go ahead.
I'm curious to what is the age of the kid that you help?
So we are the pediatric program, but we have adult counterparts. So we're really open to any age that needs that space. We will have our primary pediatric, and that's all the way from prenatal all the way up through 18. So we will run that gamut, but we also work very closely with our adult trauma counterparts. So things like Stop the Bleed is something that we do often together. So communities that want to do Stop the Bleed training, we have a falls prevention arm that our adult counterparts do a lot with. So it's not that it has to be pediatric only. The benefit of being, UW Health is one organization that has both a level 1 for pediatric and adults. So we have resources for both kids and adults, but we will be primarily based out here.
Ann?
I'm just wondering about the car seat program that you've got. Does that run all the time? Are there set hours?
Yeah, we have a calendar of events on our website. We are at a different fire station generally every week. For us, what's challenging is because we don't have space, we don't have the opportunity to do more one-on-one appointments, so we had to do either, it's a Wednesday or a Thursday or those times. Now that we have space available to us, we can offer more one-on-one with families. So if families will call us and say, hey, we're going on vacation and we need this done, we can offer that more as a one-on-one service. But yes, we are generally at a fire station at least once a week, and it's by appointment. We're usually there for 3 to 4 hours working with families. It's staffed by volunteers, so we have hospital, police, fire professionals that come and volunteer their time and help us install car seats.
And we're looking at if the resources we have are sufficient or if we need to augment them. And so one of the things we're looking at is, do we need more car seat techs in both the paid roles and the volunteer? But one of the nice things about having the fire station is the bays where the apparatus used to be allow us to not have to cancel for, a lot of our car seat checks are in parking lots, businesses, in the summer it's exhausting and quite warm for our technicians to crawl around cars and install car seats, and anybody that's done it knows that is not an easy task. So having the bays will be a nice place that, weather doesn't matter, they can pull the cart in, we can spend the time, because, installing the car seat is just one of the tasks. It's the education on how to install it, when you have to take it out, when the kid unclips themselves, all sorts of things that goes into, it's not just the buckles.
Thank you.
Any further questions at all? All right, seeing none. It seems like a great partnership for really the city, but hopefully you guys can get a lot of out as well. And I'm really excited for it. So thank you, Rochelle, Ben, and Chief Walvermacher.
Thank you so much.
Yeah, thanks for having us.
All right, then moving along in the agenda, is the consent agenda. Is there a motion to approve the consent agenda? We did that.
We did that?
Yeah, when you were.
I missed that.
in the
Oh, sorry.
restroom. Yeah.